Hi again, it's Dr. Dom. Welcome back to our series on incontinence and pelvic floor dysfunction. Today's video is all about understanding the problem, how to spot the different types of pelvic floor dysfunction, recognize symptoms, and know when to take action. So let's dive in. Pelvic floor issues might seem like one big category, but they're actually not. So they come in many shapes and forms. Let's break it down into main types you should know about. So one, the obvious one, urinary incontinence, UI, the involuntary leakage of urine, and that can show up as stress incontinence, which happens when you sneeze, or cough, or laugh. Urge incontinence is when you feel the sudden intense urge to go and you can't do anything about it. Did you know that 70% of women experience it as early as in their 30s, and it becomes even more common as we age? Then we have the scary sounding one, pelvic organ prolapse, POP. This is when one of the pelvic organs like the bladder, uterus, or rectum start to sag or bulge into the vaginal canal. Symptoms will include feeling a certain heaviness or literally just noticing a bulge. Then we have fecal incontinence, FI. It's often overlooked, and this involves the leakage of stool or gas. Around 9% of women will experience this, particularly following trauma during childbirth or as we age. Then there's a dual incontinence. As you can imagine, it's a combination of both urinary and something else like fecal incontinence. This impacts many women, especially over 50, so as we grow older. It's a significant challenge, but one that can be addressed with very correct care. How to recognize the symptoms? Well, all of these conditions can affect your quality of life, but the key to improvement is identifying symptoms early. So what should you do to be on the lookout? Leaking. Do you find yourself leaking urine or stool during daily activities like sneezing, lifting, or even standing up suddenly? This can be a major clue. Bulging or heaviness. A common symptom of pelvic organ prolapse is feeling as though something is falling out of you or bulging in your pelvis. Any pelvic discomfort, like chronic pelvic pain or a sense of pressure, is often tied to pelvic floor dysfunction. Frequent bathroom trips. If you're heading to the bathroom more than 8 times a day or waking up multiple times at night, that definitely means you have an overactive bladder. And then incomplete emptying, whether it's bladder or bowel. When you feel that you have trouble to fully empty, this can also be a telltale sign. So when to take action? It's important to know you don't have to live with these symptoms. So here's when you make a move. If leaking, bulging, pain impacts your quality of life or confidence, if you're waking up at night more than twice, it's time to check in with a professional. If you've just had a baby or entered perimenopause or both and notice new symptoms, they can help prioritize your health. If your symptoms are worsening instead of improving on their own as well. And remember, pelvic floor dysfunction is common, but it's also very highly treatable. With proper care, ranging from physical therapy to lifestyle changes and medical interventions, you can regain control. So please be proactive. Before talking about advanced options in later videos, let's empower you with some basics now. Track your symptoms. Start a journal noting what triggers your symptoms and how severe they are. Adapt pelvic-safe habits. Avoid bladder irritants like caffeine, especially after 2 p.m., and don't delay bathroom trips. It can worsen the issue. 3, try at-home exercises like Kegel exercises. They can help, but they need to be done correctly. So consider consulting with a pelvic floor physical therapist for expert guidance. And then see a specialist. There are urogynecologists and pelvic floor therapists that specialize in those issues and can provide individualized care plans. All right, so that was a lot, but that's it for today. Now you know how to recognize pelvic floor problems and when to take action. But we're just getting started. In the next video, we're going to dive into some of the treatment options, including the role of newer technologies, my favorite, because they're efficient, Emcella and hormone like testosterone supplementation. We'll talk about how they compare to traditional pelvic floor therapy. Trust me, you don't want to miss it. So follow me and let's keep going on this journey together. As always, follow me for tips on how to feel, look, and perform better at every stage of your life. Thanks for watching.